Dr. Robert Gottlieb is a cardiologist and researcher at Baylor Scott & White and is here to talk to us about a whole lot of this as well. Dr. Gottlieb, thanks for being here with us this afternoon.
Good afternoon, Jason. Thanks for having us.
So I want to ask you specifically about research into COVID-19. We know that there has been so much of that done as we are going in real time. We are learning so much as we are also tweaking how we do things going through this pandemic. What does the research front look like right now from where you sit?
Well, we are at an interesting place in the pandemic where we're at an inflection point where the cases are coming down and our supply of evidence-based therapies is continuing to increase, and that adds to the protection that we have after vaccination. So during the first 2 years of the pandemic, we started off by looking at, for example, remdesivir. Baylor Scott & White was part of the charge to demonstrate efficacy for remdesivir, and most recently we've shown that not only does it work in the hospital, but antivirals work best when used early. For example, if you have influenza, if you have the flu, no one sits at home saying, I wonder if I should take Tamiflu. They take it as early as they have symptoms. Same thing with COVID. We are now at a point where we can give remdesivir before the hospital. If you look at the NIH guidelines, Baylor Scott & White has been fortunate to be part of the conversation at making each part of that tier of guidelines. So we know that steroids work if someone's in the hospital on oxygen. We know that they're actually harmful if someone is not yet requiring the hospital. One of my colleagues, Dr. Uriel Sankovsky, was part of a trial showing that an anti-inflammatory called baricitinib also helps patients that are severe to critically ill with COVID in the hospital recover faster. And I've been part of a trial looking at tocilizumab. So if you look at each part of the tiers of the inpatient guidelines as well as the outpatient guidelines, they reflect the evidence that our partners throughout the country, throughout the world, and my colleagues here at Baylor Scott & White have helped develop that evidence.
I want to ask you.
On top of that, we have additional tiers.
Oh, I'm sorry. Go ahead.
I just wanted to share that we also have additional tiers of additional therapies to take at home. We have, for example, Paxlovid, which is an oral pill from Pfizer that it has some medication interactions that we need to manage, but if someone's eligible for it, it can decrease your risk of hospitalization by 88 to even almost 90% if started early. Test early. If you have risk factors, seek out those therapies from your physician.
Now, we've been hearing from a lot of people, asking about vitamins and like vitamin D, for instance, and asking, does that help if I am taking vitamins, if I'm vaccinated, if I'm not vaccinated? Have you seen anything along those lines that could aid you to take a supplement?
Well, I think part of being sick with any illness is being prepared by being as healthful as you can. While it's important to take a holistic approach, I think it's part of the entire package of looking at all of the tiers of evidence. I think staying fit, staying healthy, staying at an ideal body weight or trying to achieve an ideal body weight, taking a dietary supplement if you'd like, that is important, but it shouldn't be at the exclusion of searching out additional therapies if you do get sick, because we do have tools. And actually, I think part of being healthy and fit is also staying engaged. One of the things with the pandemic early on, people felt isolated when they had COVID. Now we have empowering tools. We have tools to help you recover. And if vitamins are part of your foundation, that's great, but let's also seek out additional evidence-based tools on top of that.
Dr. Gottlieb, we've been hearing a lot about, this is just going to be with us, going forward. It's going to be a normal part of life that this virus will be sticking around. But we've also heard that, perhaps it becomes less severe. Perhaps it becomes like a flu that we're just stuck with long term. Do you sort of see it playing out that way as a virus that, just like the flu, can still kill you, but chances are it won't because there are, mitigation strategies, there are vaccines, there are treatments?
I think that is an excellent point. Over time, it's going to be less consequential as we build our immunity from either vaccination combined with hard-fought recovery from COVID. And the more times your body sees it, the less ill it's going to become the next time it sees a future variant. There's a famous Dutch aphorism that says, it's difficult to make predictions, particularly about the future, and I think that's certainly the case here. But I will say, I don't necessarily know that this will become a seasonal virus. I think it will be episodic, but I don't know that we think that it will be necessarily seasonal like the influenza is so predictable. I think we have to know that it's going to be a little bit unpredictable, and only time will tell.
Dr. Gottlieb, one more thing before I let you go here. We've heard about what this virus does to people's lungs. We've been hearing from people who are still out of breath, weeks and weeks and weeks after they've recovered. Since you're a cardiologist, someone asked just a little while ago, they said, it's been some time since I recovered, and yet, this is still affecting my heart, it's still affecting my lungs. Do you see that, those longer term issues playing out with people's hearts, even if they don't have quote unquote long COVID?
So it's an interesting point. It is part of a cardiopulmonary process. Now in the lungs, some people's lungs have injury that then recover. Some people's lungs actually have holes in the lungs afterwards, and they're left basically with a residual deficit because of their lungs. It's sometimes very difficult to tease out how much is the heart and how much is the lungs, and sometimes we have to use a team approach to figure out, is it heart, is it lungs, or is it both? 2 years ago, we really worried about the heart. We know it's consequential. However, it is fortunately not as consequential for most patients as we feared it would be. However, if it does happen to you, it is something that needs to be managed.
Dr. Robert Gottlieb, cardiologist and researcher at Baylor Scott & White. Some fascinating stuff in there. Thank you very much for being with us this afternoon.
Thank you.